As we began planning this 20th anniversary celebration for our PAHO WHO Collaborating Center, we reflected, as Dr. Harper mentioned, on another significant anniversary here. 50 years ago, the tragic bombing of the 16th Street Baptist Church. But also, we're celebrating in Birmingham the 50th anniversary of the Way Forward, changes that have happened and that will continue to happen. So the theme of Dr. Ferguson's presentation, Bridging Gaps in Diversity, resonated throughout all of our discussions. And we wanted to do something special to mark this significant event in the history of our city, but also how far our School of Nursing has come in terms of diversity of our faculty, our staff, and our students. We also wanted to look at nursing as a profession, as a whole, and how important culturally competent, patient-centered care is to our patients and our profession, and the importance of our PAHO WHO Collaborating Center in this initiative. Because you see, everything that we do as nurses and as educators is global. Global health doesn't mean going to Zambia or Chile or Guatemala to teach nurses or to provide health care. Health problems like HIV, heart disease, obesity, transcend national boundaries and ethnic groups. And these are important global health problems, and we can all learn from one another by sharing. Today, as we use our experiences at our PAHO WHO Collaborating Center to educate students, we teach them about diversity and equity, not just in terms of healthcare disparities and access, but we teach them about the need for diversity, equity, and respect among an interprofessional team of problem solvers, and how health problems have to be addressed by nurses, physicians, pharmacists, even engineers and business people to be solved. We're all working in an increasingly diverse and global village, and the lessons that are learned from our PAHO WHO Collaborating Center that we as scholars are able to pass on to the next generation of faculty and students, whether they choose to practice in their home or seek to make an impact abroad, we're teaching them to think globally but act locally. Something that sets the stage for success no matter where you are. The two panels that we have this afternoon are made up of key members of our UAB School of Nursing community who represent global citizens in every respect, every sense of this concept, and who are here to give their take on diversity and its issues in the early days of UAB School of Nursing, and on the issues of diversity today as it pertains to the work that nurses do with all of the patients that they serve, both here and abroad. So let me introduce the panel, and as I introduce you, maybe you can come up and find your seat at the table. First, we have Anita Smith, former medical editor of the Birmingham News, who operates a Birmingham-based writing company. She has written several books on health and business, including a history on the first 50 years of the UAB School of Nursing. A founding member of the school's Board of Visitors, she is researching and writing a sequel to update the school's history, so watch for that. Dr. Delois H. Skipwith Guy was the first African-American faculty member at the UAB School of Nursing. She's a DSN graduate in the school. During her 2.5 decades at UAB, she pioneered as a nurse educator in teaching psychiatric mental health nursing and researched community health and gerontological nursing. She also researched caregiving for Alzheimer's patients. And Dr. Charlie Dixon, faculty member at the UAB School of Nursing for 37 years. She was the first African American to serve as president of the Alabama Board of Nursing. She's a member of the American Academy of Nursing, the Alabama Nursing Hall of Fame, and the Academy of Nursing Education Fellow in the National League for Nursing. This is our Diversity Then panel. Now we have our Diversity Now panel. Dr. Karen Meneses, who was the person who won the NIAR award. Dr. Meneses is Associate Dean for Research in the UAB School of Nursing. She has had sustained research funding in breast cancer survivorship for more than 25 years, served on the National Cancer Advisory Board, and is on the Centers for Disease Control and Prevention Advisory Committee on Breast Cancer in Young Women. She received the 2013 Ada Sue Hinshaw Award, one of the highest honors given to a nursing researcher. Dr. Randy Moore is a 1993 graduate of the UAB School of Nursing. So this was the year of the founding of our PAHO WHO Collaborating Center. He's an assistant professor in our school and also an instructor in the VA Nursing Academy. He is also a 20-year Navy veteran, 14 of those years on active duty, served a 7-month tour in Iraq where he was a combat nurse in a forward surgical hospital in 2006. Dr. Gwen Childs is an assistant professor in the School of Nursing and a recipient of a K01 Mentored Research Scientist Development Award from the National Institutes of Health, National Institute of Nursing Research, for her project, Development of an HIV Reduction Intervention for Adolescent African American Girls. In 2012, she was elected as a two-year term as Director at Large to the board of the Association of Nurses in AIDS Care. And then Dr. Martha Dawson is going to be our question and answer moderator. She is a BSN and MSN alumnus of the UAB School of Nursing and an assistant professor in our school, also a WHO Collaborating Center scholar. She helped develop the UAB's school's initial Enrichment Academy for Nursing Success program, which offers enriching educational experiences and financial assistance to students from diverse backgrounds. And she continues to consult for that program. She's also a fellow in the American College of Healthcare Executives. So welcome all of our panel. I'm going to turn this over to Anita. Maybe, I guess just pass the microphone. Maybe.
Can you hear me? All right, first of all, before I'm supposed to talk about the 60s, from the view of a reporter in Birmingham and Alabama in 5 minutes. And before I do that, I want to give you my little simple version of diversity. I think diversity, or the absence of it, is born out of what our mamas and daddies taught us, the role models they presented or didn't present, what we learned from the schools we attended when we were young, the churches where we worshiped, how we interacted in our communities, and as we grew up to be big boys and big girls, what we chose to reject and accept, and what ended up being in our hearts. Having said that, let's go back to the 60s. I came to work as a reporter for the Birmingham News on June 15th, 1964, 9 months to the day after the bombing that took the lives of 4 little girls in downtown Birmingham. The violence didn't stop there. I wish it had. It didn't. At age 22, I felt myself catapulted into a world of covering something that to me, y'all, now seems sort of like a series of dreams or nightmares. There were the bomb threats and there were the bombings. There were the White Citizens Council meetings and the Ku Klux Klan's meetings. There were the things that inspired me, the protest for the nonviolent. Their protests through marches, their protests through speeches. And then there were the reactions of the violent against them. I remember standing one day at a KKK meeting with the crosses burning and the rhetoric spewing, and I stood there and I looked at this angry white man and I thought, how in God's green earth could there be room enough in your body for that much hatred and that much bigotry? At the same time, I was also covering UAB. I became medical reporter right after I came to the paper by a lovely, wonderful, blessed fluke, thank you God. And I saw an oasis be born here. It was an oasis that really connected, and I saw some of the things planted that have resulted in this university becoming 7th in the nation in terms of diversity. Now, I'm not saying everything was sweet and roses. One way that you achieve a lot is you have a lot to achieve. One way you really overcome problems is that you got a whole bunch of problems. And I could spend a whole bunch of time telling y'all things that I witnessed firsthand in the ER over here at University, on the segregated wards in the hospital, but we'll go there another day. But they were very fortunate that the founding fathers of this university, there was a coalition of them, including the founding father, which was Joe Volcker, who believed very strongly that this could be a diverse university and that it could help lead a city that, when I was covering this, was very close to collapse. And in my personal opinion, if it hadn't done better, it needed to collapse. But I have spent many hours talking with Joe Volcker in years gone by about what he believed and how he wanted to see things go forward. And one of the things he told me one day was, he said, Nita, it's not going to be just what we do. It's not going to be just what we say. It's going to be attitudes that people can feel. And I'm going to give you one example of an attitude I felt one day that still moves my heart and makes me cry. The time was March 1965, the time of the Selma to Montgomery marches. There were 3 of them, as you know. Only one of them completed. One of them stopped at the Edmund Pettus Bridge with tear gas and clubs. Another one with a bunch of people who really believed, who knelt and prayed. The third one made it all the way to Montgomery. There were people who died. One of the people who died was a white minister, a Unitarian minister from Boston, Massachusetts, by the name of James Reeb. He had come at the call of Martin Luther King as he invited and called upon clergy from all over the nation to come and join in this march for voting rights. Okay, so James Reeb arrived. He's going to participate in the march. He and 2 other ministers go to dinner in Selma, Alabama, at an integrated restaurant. They get off the beaten path. They're walking back to the church, which is the headquarters, and 4 angry men with billy clubs cross the street, white men, and they see 3 white ministers, which made it madder than if they'd been black, who had been down there supporting this Voting Rights Act. They beat them with clubs. One of them still talks about hearing the crack when it cracked James Reeb's skull. Okay, so he was taken to Birmingham, Alabama, and to UAB Hospital. They did surgery. No neurosurgeon could have saved his life. His brain did. And I sat there in the room with reporters who had come from all over the world to cover the Selma March. And when James Reeb was clubbed, they moved right up the road up here, and they filled up that room at Hillman Clinic. We sat there, and I felt in that room the attitude that Joe Volcker told me that you could feel, that he wanted people to feel. There was an assistant administrator by the name of Jim Crank. You remember him, Scotty. Wonderful human being. And there were 2 nurses, I do not know their names. They were the ones who came to give the bleak report every time. That, hey, he's still brain dead. Hey, you don't get unbrain dead. And they would come in and they would give a touch, and they would give a hug, and they would give a press of the hand, and they would talk to the family, and they would talk to us, and they would say, I'm sorry. And Jim Reeb lived sensitivity, and he lived compassion, and he handled that horrible situation with grace and with love. And I had a guy from Time Magazine who turned around to me, and he said to me, Miss Smith, y'all are not all like that, are you? And I said, no, some of us deplore that. We just happen to live here. And they brought us coffee, which I don't drink, but they brought us Coke, which I do. And we sat there, and this girl from Pittsburgh who was on some paper or something, she looked over at me and she said, isn't this great? And I said, what? I mean, somebody's just been clubbed to death, and I thought, what's great? I said, what's great? And she said, this attitude, the way y'all are handling this attitude. And that has been perpetuated here, and it's been perpetuated here at this school, because God bless the school. The school's lucky. Scotty has said many times, the school's been blessed with good leadership. And you don't get good faculty, you don't get good staff if you don't have good leadership. And this school was founded by a Mennonite lady who didn't know anything except to be good people. She was succeeded by a woman who was grounded in Minnesota values and then had that free spirit from California, you could do everything, who believed in diversity. And she was succeeded by a girl from South Carolina who came here and thought, hey, we ought to step out on the global stage. And she was succeeded by somebody I call the Queen of Collaboration. who believes deeply in her heart and soul that there is no difference in diversity and collaboration and openness and acceptance and tolerance in people working together. And all that explains why I've interviewed so many people who graduated here who told me the one thing they learned from the UAB School of Nursing is a belief in diversity of thought.
I'm Dolores Guy, and when I was invited to do this, I hesitated because of some issues in my own life, and then I said, well, call me the first of the year and I'll let you know. Always knowing that I would come if my situation permitted it. So I'm glad to be here. And I want to say, and I have some notes, where's the timekeeper? Because I don't want to go over my time, because I know I will. I was introduced as being the African-American person who came to UAB School of Nursing. It's really UA School of Nursing, that's at UAB, as the first nursing faculty member. And I have to put that in context. I had applied to enter as a student and was denied admission. I had applied for a faculty position and I was initially denied. I can remember Marie O'Corin coming to Indiana University, where I was a graduate student, to do an NLN visit. And I introduced myself, and she said, well, gee, you might want to come to us when you come back home. And I said to her, and I remember as if it was yesterday, the university may not be ready for me. And initially they were not ready for me, but they became ready for me. They were in transition, as many of you know. They started in Tuscaloosa. They were the second baccalaureate program in the state, but they saw that if they were going to become, as a school, the school they deserved to be and wanted to be, they had to come to Birmingham. So they had moved to Birmingham in 1967, and in 1969, Dean Hickson called me, and she called me in for an interview and asked if I was, well, really, she called me first on the phone to see if I was still interested, and I was. Things were in transition, not only in academia, but in the city and in the state and in the world. You know, we were still, to some degree, segregated, not to some degree, most degree, segregated. We were still trying to get acquainted with this new thing called integration and how to make that transition. So everybody was in transition. Everybody was on high alert. So when she invited me to join the faculty, I said yes, knowing that there would be some challenges. And I came, but the transition was made relatively easy by some of the attitudes of the people who were here. Now, I've had the good fortune of working directly with all of the deans except for Dr. Harper. That's meaningful to me in that they contributed to me staying at the UAB. I came, but I didn't have to stay, and they didn't have to keep me. But something happened that we met each other's needs, and we stayed together. There was also the transition. When I came to Birmingham in '69, there were not many master's prepared nurses of any color. And you have to put that in context. As Dr. Ferguson spoke about the diploma programs, the AD programs were just coming on, and you had to wonder, well, what's going to happen to nursing? Nursing was in transition with medicine. We had practiced in an environment where physicians were the head of the team, they were head of everything. They wrote the orders, gave the orders, expected them to be followed. That was the environment. We had to establish ourselves in academia. So it wasn't just coming to a world in which I was the only black present in many environments, but I was a nurse trying to make my way in a university setting. Many of you may not know, we were not always in this lovely building. We were in 3 little buildings spread throughout Birmingham. There was a big building on 8th Avenue, General Studies building. and we grew as a university. We were existing in many ways side by side, but not yet developing relationships. But as we spent time together, got to know each other, developed and accepted the same goals and mission, we built relationships. We began to trust each other, respect each other. There was not as much of the, what I call it, censoring of communication. But people, when I first came, people had to kind of censor what they would say in your presence because they had their own conversation and their own words. So they had to censor that and get ready to that there's somebody different in this room. We had to break habits. I had to break habits, they had to break habits. But we hung in there and we grew together. There was also competition. We were not only competing for applicants in nursing, we were competing against University College for students. Institutions were competing with each other for faculty, for students. Everybody was trying to get the cream of the crop. Historically black colleges and universities were struggling in that people who ordinarily would have become their students and their faculty were going someplace else. So we had to grow through that. And we had to move from being competitive to how to exist together, how to coexist. I came to UAB, and it was not long before Marie became dean, and she began to recruit other people. Charlie then came along. But the thing about us coming, we didn't stay the only black faculty members. There were many institutions who made it a point to recruit one black person, and they stayed with one black person. I'm just telling you what it was. They said, well, we got our one. That's right, we've got, but that was not the case here at UAB. It was not the case at the School of Nursing, and I'm glad for that. And I always hasten to tell people, yes, I was the first, but I was not the last. Praise the Lord. And we have to keep growing in that. About mid-1974, Dr. Carl Miller came on as the first male faculty member here. So, you know, there was a growth in the diversity. I made some notes because, see, I would talk forever. We were in a period where there was capitation money. The more students you got, the more money you got. So we were into educating more students. We were beginning to sell the idea that people ought to have a baccalaureate degree. We were beginning to sell the idea that you can't practice in the hospital for the rest of our lives. We got to go out into the community. And oh, what a trouble that created. Parents called, parents came, lawyers came, lawyers talked. We grew, but we knew we could not stay in the hospital. We had to move into community. I heard Dr. Ferguson talk about technology, and it reminded me of when we started requiring a course in computers. Way beyond our times, too early, but we were right. We knew we had to go there. So when other people finally thought about doing it, we had done that, gone on to something else. Now the movement, regardless of race, we were learners. We had to learn about each other, we had to learn about culture, and we developed some friendships and some relationships. But I have to share with you, and for some of the older ones in the group, you will remember Eloise Clark. She was the first person she was the only psych person who was up here. So she was my colleague when I first joined. And if it was anything that was going to discourage me when I came to the School of Nursing, it would have been my office. Now I'll have to share with you, I was in a little hole in the wall in the back of the rented building. But Eloise shared that office with me. I am glad she shared that office with me. Eloise taught me a number of things now. I don't know if that was Eloise's office before I came, or Eloise was the kind of person that said, well, if Dolores is going to be in that office, I will share that office with her. We only stayed in that one term, and then we moved up front in the building. But we were privileged in our building in that we were close to where the dean was, because she was across the street and in the building. Now, there were the people who were in Salvation Army building that were far off. So I'm thankful for the people I had an opportunity to work with. The other thing is that we experienced some success, not only as a school of nursing, but as a college, in that we began to grow together. And it wasn't University College against the Medical Center, because there was a time when University College was struggling and wanted all resources, and the medical school knew they were deserving of all them resources. Then we moved to things like political correctness. But let me say about some of the things that I think helped this school to grow as it relates to diversity. Not only was there recruitment, but there was continuous recruitment. Like I said, they could have gotten one or two and just been satisfied with that. But those of us who came, we contributed to the diversity of this university. And at one point in time, the diversity within the School of Nursing helped the diversity within this university in that we made their count right. We helped them to have their percentages because people did count. You had to write reports on how many people you had. And you don't tell me you say you can't count and we don't know. You had to count. Students, faculty, and staff. We had opportunities for professional development within the school, within the state, and within the region. We were given opportunities to serve on committees, have visiting professors come. We had a group of faculty who became so good at test writing that they were invited to do a bank of test items. You know, that was the kind of growth environment. And we grew to trust each other because of what we knew and what you knew those persons could do. There was an environment of let's keep who we have and get some more. That's important because you can bring people in and it can be a revolving door. They're in and gone. Because you were always having to fight competition for the talent. So there was professional development, there was sabbatical leaves, there was short-term leaves, but there were things to help us grow and meet the university standards of what we had to be as academicians. There was always a commitment to help each other. And that's the only way we all survive, black and white, here together. If we had been or continued to fight each other, this university and this School of Nursing would never have grown to be the great university that it is. So at some point in time, we all grew to know that if one of us is a winner, all of us are winners. And so we grew bigger and bigger. We got to have consultants, we got other people trained in different fields, and people were coming to us to learn how to do things. And I am glad I came, glad I had the tenure here that I had. And the challenge now is to look at diversity in a broader framework. At that time, we looked at it as, do we have black and white? And do we have males and females? But now diversity is a whole different ballgame. Calls for changing in your values, but it still demands respect and commitment.
Dolores, you made the task easier. During our public health experience, Dolores lived with my family.
That's right.
So we've been around together a long time, more than 60 years now.
Oh, yeah. No, and I'm just thankful for all of it. I'm very clear about that.
Taking a line from Mr. Rogers, it's a beautiful day in the neighborhood. It was not always a beautiful day in the neighborhood. My first position was at Lloyd Nolan Hospital in Fairfield. Tennessee Coal and Iron, a part of U.S. Steel. Mm-hmm. They called me Nurse Jones, and they called my white colleagues Miss Branyon, Mrs. Smith. I was assigned to the second floor to take care of colored males. Mm-hmm. After I worked there 5 or 6 months, they decided that I had the knowledge, skills, and abilities to work with white females and private patients. So I was given an opportunity, they said, to work on Section K. After a year, I left Lloyd Nolan and accepted a position at the VA hospital. It was during the time of the civil rights movement. I was on a 3 to 11 shift at the VA hospital, working orthopedics, where I was the only nurse on a 30-bed unit. I gave medicines to the TB patients upstairs and cared for 31 patients on the 3rd floor. That was not the bad part or the difficult part. The difficult part was journeying to work. I had to drive down 6th Avenue South, and on each side of the street, you found state troopers. There were state troopers up and down the street, and certain little areas like Midfield, I was afraid to travel through that area because it was a white community, and my parents told me, you don't go that way. You don't go that way to work. Yeah. They asked me to focus on my experience with the Alabama Board of Nursing and my experience with Dr. Lillian Harvey, who was Dean of the School of Nursing at Tuskegee University. Now, as I scanned the room, I know that a number of you will not know this person. You might know him from 60 Minutes or some other newscasts later. I was appointed to the Alabama Board of Nursing by 5 different governors. But my first appointment was by Governor George C. Wallace.
That's right.
A staunch segregationist who is best known for his stand in the schoolhouse door at the University of Alabama. And the opportunity to do that it causes you to be a bit emotional. There were a number of things going on in the state. The legislators were trying to pass laws for mandatory continuing education in the state. There were nurses who spoke out against mandatory continuing education. Senator Danny Corbett from the Auburn-Opelika area was pushing for mandatory continuing education. This was at the same time that Governor Wallace was shot in Laurel, Maryland. So it seems as if my world was getting smaller. What's going on? Governor Wallace has been shot. They're pushing for mandatory continuing education. I have to convince nurses in this state that we need to support mandatory continuing education. I have to help them understand that regulation exists not to protect the nurse, but to protect the citizens of the state of Alabama. So I collaborated with a number of people, and some of the nurses might not know why we have 12 hours of continuing education each year. It's because Danny Corbett was a realtor, and the real estate people had 12 hours of mandatory But I learned a lot about politics at that time. I drove around the state with Charlie Graddick, who was once on TV and said, put the criminals in jail and lock them till their eyes pop out. I rode around Alabama, but Charlie Graddick, just as Governor Wallace gave me the opportunity to serve, Charlie Graddick helped me to convince some nurses that did not believe in continuing education that it was good for the people of the state of Alabama. Now let me share with you a little bit about the nursing program at Tuskegee University. Dr. Lillian Harvey was dean of the nursing program there. She was a crusader for professional recognition. Dean Harvey served during the time of discrimination and segregation, and established the first baccalaureate nursing program in the state of Alabama. It was her courage and foresight that caused that early approval by the National League for Nursing by a nursing program in a historically black college and university. Now, Dean Harvey called her students her jewels, and she had a saying that went like this: come as you are, but leave as you ought to be. Dr. O'Corin hired a number of graduates from Tuskegee University. But Dr. O'Corin didn't hire based on affirmative action. Dr. O'Corin hired because we were qualified and had the knowledge, skills, and ability to do the work that she needed to have done. Dolores Guy was there from Indiana University. Dr. Arthur E. Campbell was there from the University of Maryland. Cora Ingram was from the University of Maryland. I was there from Ohio State University. Marion Henderson was there from Michigan State University. Dr. Bertha Davis was also trained by Dr. Lillian Harvey, as well as Dr. Pam Hammond, who is now provost at Hampton University. Now, I want to stray away from that a little bit so that I can mention an initiative that's similar to what Dr. Ferguson mentioned some time ago, that you have to help the people in your area before you venture out to other countries to help them. Dr. Scotty McCallum initiated an initiative called Titusville 2000.
Sure did.
I was a part of that initiative. Titusville is a community very near the University of Alabama at Birmingham. It was Dr. McCallum's strong belief that the knowledge, skills, and abilities of university faculty members and staff should be used to assist the people in the community. So you could see Dr. McCallum out in the public housing area on Saturday. He worked to bring after-school programs. Dr. Mel Shipp, who is now Dean of the School of Optometry at The Ohio State University, was here at that time, carried eye screening and other programs out to the people in the community. So this idea that you mentioned, Dr. Ferguson, about helping people in the area, that started at UAB a long, long time ago. That it was not new for UAB. Now, a number of people might reflect back on what I said about the time at Lloyd Nolan, trying to live in this city, Birmingham, Alabama. Would I do it all over again? I would do it all over again. I am very proud of the 27, not 37 years at UAB. The Lord said, yes, we're old. I was not here. It's not here 37 years. I was here 27 years. I knew Dr. Volka, Dr. S. Richardson Hill, Dr. Scotty McCallum, Dr. Bennett, Dr. Reynolds, and all of those people that served in leadership roles here at the university. And sometimes when you do surveys, they ask you, would you recommend this program to others that you know looking for similar opportunities? My answer would be yes. I would recommend the University of Alabama at Birmingham to others.
So thank you. I would just like to first start off and say what a privilege it is to sit on this panel today. It's just really an enormous privilege. I think about standing on the shoulders of giants, and we have several giants here with us this afternoon. So I'm to start the second portion in terms of what is diversity now and how different it is, and it's so wonderful to hear the struggles and the history that we've all gone through in that regard. We talk about diversity of UAB, and UAB, whether it ranks 4th, 5th, 6th, or 7th, in terms of campuses here in the United States, that's still hugely tremendous to be the 4th, the 5th, the 6th, and the 7th most diverse campus. It just doesn't start yesterday, many, many years ago, maybe a little bit more than the 27 years ago. There has been significant changes and increase in our diversity here across our faculty, our students, as well as the patients and families that we serve. So what does diversity mean to School of Nursing today? We've heard a little bit about that earlier. It doesn't just mean access, but it means richness in thought, the innovation through shared experiences, the increased understanding that we have of our patients and families, particularly among our students, our faculty, and our staff. The UAB Office of Equity and Diversity has a focus specific on diversity. We need diversity, it states, to attain excellence. And also it states that the responsibility lies within all of us here at the university, the leadership team, the administration, faculty, staff, as well as students. So I was just asked to give a few sentences or share a few experiences from what I've seen. And I've only been here a little over 6 years. I've seen so many changes within the past 6 years in terms of diversity. When I first got here, most of the funds in terms of support for minority fellowships went to the School of Medicine and the School of Public Health. We had none that came from the School of Nursing. And the reason we didn't have any was because we hadn't asked. We really hadn't asked on a consistent basis. So if you think about it, we said, well, let's go and take a look at these minority fellowships. So in 2006, the very first faculty received a minority fellowship here in the School of Nursing. And we have consistently received those minority fellowships since that time. That meant that 7 of our minority faculty, so it wasn't just the one, it was that continued recruitment of extremely qualified faculty. And also to engage our minority students as well so that they can also see the changes as well as mentoring that would be so important. In any event, the fellowships allowed 60% support for the first year and 40% for the subsequent years in order for our minority faculty to be able to maintain and focus on their scholarship as well as their research. And several of those faculty are here, including one at the table. But out of this group of 7 faculty, they garnered more than $1.1 million in scholarships. And that's not just specific to the funds, it's the work that they've done with their students, as well as the care that they have subsequently been able to provide for their patients and their families. 2 of those fellowships are still currently in progress. But in addition to that, we look at not only diversity, not only in terms of access, not only in terms of gender, or not only in terms of poverty, but also the disparities. And the disparity may be in many other different ways. So here on campus also, with the Health Disparities Training Program, we had 10 faculty that have been trained since 2006 with regards to looking at the diversity. 2 of those faculty submitted R1s. One of those faculty has been subsequently funded with a R21 award. One of them has subsequently received a K award, and that is currently in progress. And so the return on the investment in terms of the work that they have made has been a tremendous boon. You think about that today in 2013 and 14. And think about what Dr. Ferguson talked about in terms of examining our scholarship and our research, generating that knowledge, and being at the table. We continue to have minority supplements to different grants, but really more than that, it's really broadening to help our patients and families who have the poor access to care, including those underserved, our minority, our rural, and those in poverty. Those not just who are underinsured, but those are and have no insurance as well. If you take a look at what we have in terms of some of those outcomes, they've really been tremendous. It's been from the very, very low birth weight infant through our adolescents, our adults, as well as our elderly. The different kinds of side effect management, symptom management for those with chronic illness, palliative care, caregiving intervention research, care-resistant behaviors among our elders with dementia, living in nursing homes, adolescents at risk for HIV, innovative intervention delivery, gaming, telehealth, telephone, electronic interventions. These are what our faculty, who have had diverse thought, ideas, backgrounds, clinical experiences, have all brought to the table. And I know my other colleagues here at the table will be talking more about some of the highlights in terms of education. Our undergraduate, our graduate students, our doctoral students, they come from all over the country, as well as internationally. And the richness and diversity that they bring, not only in their ideas and thoughts, but what they bring to the table in terms of care and outcomes are tremendous. I'd also want to just highlight another area, and that is access for our underserved populations, particularly the tremendous work that is being done through our Office of Community Affairs and Partnerships through the Empower Clinic, as well as with the Foundry, and lifting off of these enormously important and critical programs here, locally. This is our global reach and our local way in terms of support for the care of these underserved groups and populations. I really loved the title, Dr. Ferguson, in terms of bridging gaps, because we see through our students, our faculty, and our staff, those gaps. We see them very, very clearly here. And I believe that the faculty and staff and our our students will continue to blaze these trails ahead. Thank you.
Well, I'm honored to be here, and would not be here were it not for some of the cadre of nurse teachers that are here to help me through my undergraduate program, my graduate program, and through my doctoral program. And I'm also honored that with 20 years as an RN and being halfway around the world, I am the junior member of this panel. I had a manifesto written, and it goes back to 250 BC in India when a nursing school was founded. For men, only men were considered pure enough to become nurses then. Saint Benedict and Saint Alexis founded a nursing order in the early part of the turn of the century, 2 centuries ago. The Alexian brothers had informal groups of laymen providing nursing care to the poor in the 1300s. The first American nurse is noted in some texts as occurring 70 years prior to the Pilgrims' landing on Plymouth Rock, when Friar Juan de Mina was shipwrecked in what is now Texas, and was the first identified nurse in what was to become the U.S. And then we get forward to the U.S. Civil War. Both sides had men serving in healthcare roles, and some of those were serving as nurses. The men were the majority of the frontline nurses, and the female nurses typically worked in the general hospitals in the major cities. Not until 1955 were men allowed to serve again as military nurses. They've been known by numerous names throughout the years, and sometimes they're aides, and sometimes they're apothecaries, and sometimes they're techs, corpsmen, nurses, and but the formal training for an RN was that allowed military nurses. A law signed by President Eisenhower authorized male RNs reserve commissions in the Army Nurse Corps. 11 years passed before male RNs were authorized to receive regular commissions in the Army Nurse Corps, which was in 1966. So the generation of nurses that I trained under, if I ever did find a male nurse, the male nurses in that generation were around 1%. 1% of all RNs. When I came into nursing school in the early 90s, males in nursing were around 5 to 6%. It's hard to pin down the number, but in 2013, that number is around 9.6%. Almost 10% of RNs are males. And new male nursing students are around 13%. I would note that in support of UAB's diversity, that this last class of RNs that started, they've been in nursing school for 4 days now, had 20 males in a class of a little over 100. So we're approaching 20%. So that's fantastic. I would like to close just with one story that men in nursing, a lot of us tend to gravitate toward the military. Males in the military nurse corps, be it any of the branches, hover around 29 or 30%. So the numbers are higher in the military. And when people get out of the service, they may gravitate toward that same hospital and become a government service worker in a military hospital, or work their way into a veterans hospital. And I'm very proud to work for the Birmingham VA under the VA Nursing Academy partnership that affords me the opportunity to be a full-time instructor here, and which I've done so for a little over 4 years. That's a wonderful partnership that continues to grow by leaps and bounds. The school was recently awarded a Veterans to BSN grant for over $1 million to recruit former corpsmen and medics to become RNs, and we're targeting those aggressively. And I did deploy with a Ford Surgical Hospital to Iraq in 2006, and part of our mission was to help train the Iraqi army, and they had their own medics that were coming through, and a lot of those medics were very, very basic, and it would be what we would consider a first semester nursing student. I mean, we were struggling to get them to figure out how to take blood pressures and temperatures. And those guys would rotate through with us for a couple of weeks. And I had one gentleman, and the interpreter said, that gentleman right there was a nursing student at the University of Baghdad. And I said, come to me, and I asked him a couple of questions. And he was like, oh, yes, I'm a nurse. I'm a nursing student. And I had to challenge him because that's what we do with our young, right? And so I asked him a couple of senior-level nursing questions, and boom, 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 he was on the money. And it gave me a flicker of hope that in that region of the world, once the dust settles and people quit shooting at each other, that they are going to be able to care for themselves, and it was a proud moment. Anyway, I'm happy to be a nurse. I don't call myself a male nurse. I just call myself a nurse, and I'm proud to be sitting here in front of you today.
Good afternoon. I'm honored to have been asked to be on a panel and talk about where we are now, but I'm more humbled about where we were and the groundwork that was laid to get us to where we are. And I was asked to talk about the importance of diversity of faculty, students, practicing nurses, and importance of diversity in research. And just in listening to the stories about, okay, I have one, I can actually, unfortunately, know that, even though I graduated with my BSN in 91. In my previous institution, when I was hired, I was then 2. And then 1 left, and I was the only one. So anything that came up related to diversity immediately fell on my office desk. And it was very stressful because it wasn't that I was being asked to do it because of experience, because I was still new. I was still learning how. Back then we were doing transparencies, and I was still trying to figure out how to do that. So when I did finish my doctorate and I came here for an interview, I was a little skeptical. I'd never been to Birmingham before. I knew the history, and I was very, very skeptical about UAB. And I remember meeting with Dr. Harper, and right up front she said, my goal is to increase diversity in this university. However, you would not be sitting in my office talking to me if I didn't feel you were qualified. I thought, thank you for putting that out there like that, because I want to be here because I'm qualified. And in the 6 years that I've been here, I've watched the people who have come through for interviews, people who have been hired, and people who have not. And the people who walk through the door, regardless of their race or gender, are qualified. And the thing that pleases me the most, especially when I go to conferences and people are asking me, so how many African American faculty do you have? And when I start going, well, there's Comfort and Ann and Glenda, and once I get past 5, they're like, are you kidding me? And I'm like, no. Well, how many of them have their doctorate? Well, everybody that I've named so far. And they're just totally astonished because the diversity that I see here is not the diversity that exists at other places. The diversity that I see among researchers when I go to research conferences is not what I see here. The number of African American researchers that we have on faculty here at UAB, I have yet to go to a conference and talk to someone, and most of them either have none or they may have one or two. So the word that is out there about UAB is commitment to diversity, is commitment to supporting its faculty and succeeding, is out there. And that word gets around, which is why, other people who are struggling and who are trying to steal faculty from different universities, because I can't tell you how many times I've been, don't you want to come work here? No, I'm happy where I am. But we don't have to do that. I mean, people want to come here because they hear about the diversity. With the students, they sent me the statistics, and I kind of looked at it, and at first I was like, interesting. But when you look at the number of BSN students who graduate every year in the state of Alabama, 16% are from UAB. Yes, we are working on that number. But the numbers that really caught my attention, because one of the things that the faculty here, I noticed, really push for are for students not to stop at that BSN, to continue their education. The number of African Americans statewide who graduate with their MSN, 45% come from UAB. With their doctoral degrees, 41% come from UAB. So when we're looking at those numbers and thinking about diversity, it, as Dr. Ferguson said, it goes beyond race, because we have students from different countries, different cultures, and if we don't have a faculty that can match that and try to understand that, then we lose that student in the classroom. We lose that positive word of mouth about you need to go to UAB. And I think we're really, getting very good at that, because even though, I may not understand, other religions or other cultures, that motivation to learn more and listening when we have, guest speakers from other countries or people who have traveled to other countries and are coming here to talk to us about what they've learned, taking that information and going back and sharing it with our students, and having our students who do have different experiences, different worldviews, encouraging them to speak up in class. I think we're seeing a lot more of that. One of the things that I have noticed about our students is they're not a quiet group. They are very vocal. And that's not necessarily in a bad way, because the things that they share, make me realize that diversity, when we were looking at experience. And I remember having a conversation with several students about, why do we need to go to the daycare to do clinical? I want to work in the hospital with children. Well, you can't understand how a sick child behaves if you don't understand normal child development. And they're looking at me, and it's like, okay, let me give you an example. I'll give them an example, and they'll go, well, I thought you don't have children. No, but I have lots of nieces and nephews who were once little babies. It's all about putting yourself in the experience so that you can learn. And so a lot of them bring that with them. And I force the ones who had, and it goes back to, I can't tell, Dr. Ferguson, I can't tell who's a student and who's a faculty anymore either. So I would have to ask, okay, how many of you have children? Raise your hand. And those who have children, I would say, well, tell me, how did you potty train your child? And just, even you wouldn't think that that's diversity, but when you're in a non-traditional classroom where you have at least 20% of the students who are married with families, with, I call them still wet behind the ears, fresh out of high school, and don't know what it is to change a diaper. Having them listen to those experiences really opens their eyes to what goes on in the world. And I think, as faculty, I've learned probably over the past 2 years a lot more about global health. I'd never thought about global health before. It wasn't taught when I was in nursing school. Everything was just focused on how to take care of your patient. Nothing was ever talked about, if you have someone from a different country or nothing like that. And I've had several students who have come through my classes who are interested in global health, and in talking with them and listening to them. And doing research in HIV, you can't do that without hearing the global health and learning about global health, because it crosses boundaries. And we no longer have borders anymore. We have people here from different countries, and they're just not coming in to visit, they're moving here. And to get students to understand that you have to think about nursing beyond the patients you see at UAB Hospital who probably grew up in Alabama and lived here all their life. You're going to have patients in there who may not speak English. How do you handle that? You may have people who have different religious beliefs. When I was a pretend OB instructor my first year teaching, we took care of a woman, and I can't remember her culture, but I didn't know that she could not have a male student assess her. And so it was major drama, and I had to go make those changes, explain to the student why they had to change patients and so forth. But it's gotten to be a bigger picture than what we used to. And the other thing in terms of research, with the onset of the DNP, we have gotten a lot of nurses to come back in and become doctorally prepared. And that's been really important because we've had these doctorally prepared nurses who are primarily academia, but not so much still at the bedside or in community settings to really push forward that practice. So we're seeing a lot of that now. And with the PhD, we're still pushing, trying to get students to understand the importance of that PhD and needing people to do research. And with that research, that diversity piece is, not just race and gender. We have to stretch beyond our borders because all of these problems of chronic illnesses, the symptom management and so forth, they cross all races, all cultures, all ethnicities. And particularly here in Alabama, pick a problem. And you've got Hispanics, African Americans, and then you have, your immigrants, you have your Latinos. There's so many different varying groups. And one of the things that, I sit on the IRB here, and a lot of the protocols that we get through, that come through for review, a lot of HIV research is being done in different parts of Africa. So they are trying to take what we have learned here and has worked here to try to translate it there so that they can start seeing decreases in their numbers. But what I don't see is a lot of nursing doing that. And I think that's the area in research that we really need to start thinking about.
Okay, let's just give everyone a hand. Wonderful seminar, workshop, whatever you want to call it. But the richness, the information has just been outstanding. I was literally sitting on the edge of my seat there, and I know I'm supposed to allow and entertain questions, but I kept saying to myself, I'm not sure where I fit in. Maybe right in the center there. I have one leg on one side and one leg on the other side. But when you think about our theme of blazing trails and bridging gaps, and I began to think about diversity and globalization, and the first thing came to my mind is that when I look at this side of the panel, I say to myself, it's no longer about integration and segregation. I look at the other side and I say, it is really about taking that soup that you just really love on a cold night, and you can still enjoy the peas, the carrots, the potatoes, the tomatoes. It's all there together, and you say, boy, this is good. That's what diversity is really about. It is about how to make this good, how to make it right, and how to take it to the next level. Dr. Ferguson said something. She said, it's about reframing. It's about refocusing. And really that is truly what diversity is about today. It is about how do you take something and you pull it together to make it better. And so I'm so excited that I'm going to open up the floor for questions now. And please have the questions, because if you don't, I may have to. Because this is just an opportunity in terms of us being able to learn, to share, and to grow together. Because when we begin to think about it, from both the fact that we're talking about education, we're talking about research, we're talking about service, but again, the caveat is leadership in all of those roles. You know, if you don't have leadership out front in all of those different aspects, then you're going to miss it. You know, I like to say that it's no longer a three-legged stool in academia. You just can't have research, service, and education. You have to make it four and add that leadership piece. So the floor is open for questions. Yes.
I have a question for the university now. First, I want to say thank you for sharing so honestly, Dr. Sally Dixon, for your experience in the 60s as a younger Black female. It means a lot to me how you blazed the trail in nursing so that I could have the opportunities to come through and get a doctorate. You know, and I'm a student, a PhD student now. And as I look at possible schools that I would go to either do another postdoc or more training and research and learning, teaching, coming from a clinical side, I've seen some of the schools that really are intimidating because they don't have any African Americans. They may not even have Asians or other ethnicities on their staff, or even men. And that's one of the things that I look at for where I would want to go. And then I hear Dr. Ferguson about speaking about leadership. And honestly, it scares me to go into a situation where there's limited diversity. And my question is, how did you deal with being the first when you went home at night? I mean, I know there are things, or a face you can put on at work, but when you go home or when you're driving to work, there are emotions and thoughts that you face in breaking the barrier of diversity. And how did you deal with that? What was your mindset?
Who do you want to answer? But let me just say something. I came from a family. And when I would leave at the end of the day, I returned to a family. You have to remember that. You have to know who you are and whose family. You belong to somebody. You are somebody before you even come over here, or whatever institution that you may be a part of. That helps to anchor you. It helps you to get through that bad day. It helps you to put in perspective something negative that may have occurred or something someone may have said. And the other thing is, you have to know that you are making a contribution, that they need you, you need them. The world's only going to be better if we become that soup she talks about. The other thing is, know where you're getting your love, from where you're getting your love. That's the reason I said, I came from a family. There were days people would, they'd look at me funny, they'd say something, and then they'd say, oh, pardon me. But I knew who I was, and I didn't look to this job as my only source of love and affection and acceptance. The other thing you probably knew from some of my comments, I am strongly rooted in my faith, and I don't apologize for that.
And I think just to add to that, we know that in every organization, in every group, you're always going to have good, you're going to have bad, and something in between. And you have to decide for yourself, what is your reality in the moment? And how are you going to take advantage of that reality? Did I see another hand up or question?
Let me just tell you, I was president of the Board of Nursing in this state for 7 years. 7 years. The board was established in 1916. There have only been, the time that I went on the Board of Nursing, there have been only 2 African Americans that served with the Board of Nursing. As Dolores said, you have to know who you are. There was no doubt in my mind that I was qualified to do what I set out to do. Never. There was never any doubt. And if you go forward with that, you won't have any difficulty.
And you come from a community where other people are pulling for you and supporting
Yes.
you. You heard Charlie talk about when we were doing public health, I lived with her family. Matter of fact, she didn't tell it all. There were 2 of us who lived with her family. Her parents gave us a room, they fed us, we did our clothing in their washing machine. That was family. We were last summer at Tuskegee. Our public health experience was up here. So you have to find your family. You talk about going to places that are different. Where's Wanzetta? She's left. In '93, I went to Salt Lake City, Utah. I didn't know anybody. Now, you know how many black people are in Utah. But let me tell you, there was and this is why it's important to pay attention to your bulletin boards. I had gone out for lunch, came back waiting for the elevator to come, and there was a flyer on the bulletin board talking about a postdoc in caregiving at the University of Utah. I ran upstairs. Charlie, I have found where I need to go. I went and stayed that year. Best experience. Speak loud for us.
Can I have a comment? I don't have a question, but I do have a comment that might help you. I've been in the first position for a few things. I used to be a PhD student. I went back home to Saudi Arabia. I was selected to be in the hospital research committee, and I invaded a physician space, and I was the only female, and I was the only nurse in that committee. And before the end of the year, I became the chairperson of the retrospective research committee. And before the second year, I was a membership in the whole corporate for National Guard research IRB member. And until now, I'm still holding that position, even though I left the institution. I tried to resign. Except me for my second place that I've been the co-chair for the IRB, where I was the first and I'm the only nurse again, and I'm very invaded, if I would say, physician's boundary or a professional boundary. I've been the first Saudi nurse, palliative care nurse, where in an institution in the whole country there was none who was working in palliative care. So I believe in faith, and I believe in destiny, and I believe that God chooses for you also the best. Even though you think and you have a vision, but believe me, your vision is if it's very clear in front of you, you know where you're going. You have a strong belief in yourself and how much you can achieve, you're going to be good in anywhere, whether it's a full minority or a segregated community, you will be able to make a difference and contribute as much as you can. So I hope I'm helping you with this.
You have another question?
I have a comment. My name is Dr. Carol Wycliffe, and I was born and raised in Selma, Alabama, so I know exactly what you're talking about. My mother was the first African-American registered nurse in Selma and was a nursing supervisor at Good Samaritan Hospital during the Civil Rights movement and helped transport people from across the bridge back to Good Samaritan Hospital, which was predominantly the only African-American hospital there other than the one that was owned locally by the Andersons and so forth. The other hospitals were, segregated, where they only took care of white people that live in Selma and within that community. I have, I don't know whether you want to call it being fortunate or what, but been the first in many situations. And just 19 years ago was the first African-American director of surgical services at a Catholic hospital in Lake Charles, Louisiana. They had no registered nurses in this hospital, and they thought that I was the new housekeeper. And I'm being honest, they thought that I was the new housekeeper. But I say that because still today, in 2014, people are still afraid to talk about diversity. People are still afraid to approach a diversity from a standpoint of the importance. I stayed in that organization for almost 9 years, was promoted to chief nurse within less than a year and a half of being there as the first African-American chief nurse executive of that hospital. I was the first African-American chief nurse executive of what was formerly Medical Center East here, and the only one in St. Vincent's Health System, which is the oldest hospital system in Birmingham, over 100 years old. And I think it's all about relationships and, like you're saying, knowing who you are and believing in yourself and what you can do and recognizing what people bring to the table. Because you can't accomplish anything in life by yourself. When I was in Louisiana, there were 3 African-American physicians on a hospital staff of over 200. When I was at St. Vincent's East, it was 4 on a staff of over 200. So it's all about relationships and being able to work with people and respect and trust. I think that's very, very important. I think that I don't see color when I talk to people because I want to recognize what that person's bringing to the table. And I teach my students, I'm a faculty member now, an associate professor, and I teach my students that it's okay to talk about diversity. It's important, and I think that when you're in a situation and you have a vacant position on your team, you need to be comfortable with telling human resources to bring you a diverse pool of applicants. That's not focused on race, that's not focused on gender, but bring me a diverse pool of applicants, and we need to be okay with saying that. And I think in today's environment, you still don't have that, and we don't have enough people being comfortable with talking about diversity.
And it's like Dr. Ferguson said, a lot of times, she didn't use this term, but a lot of times it's useless rhetoric because people are really not addressing the real issues because they're afraid to address the real issues because they're afraid that will bring their little sandbox down. And they're really trying to put forth the right words and protect things the way they have been. Yeah. What is your name?
Carol Ratcliffe.
I thought so. I've interviewed you.
How many has she not?
Dolores mentioned that.
But I knew I had.
Dolores mentioned that none of us worked with, none of us worked. I have worked with her. I have worked with her, and she was very supportive of an effort that we made to continue a very fine nursing program at Tuskegee University. She came down, served as a consultant when I requested her to do that, and met with the president of the university and others and spoke strongly for a nursing program at Tuskegee University. Didn't think twice about this is going to take students away from UAB. And I hope you're still that good person that you were then.
Okay, well, listen, we do appreciate your questions. We're going to have a reception after this. And again, thank you all for coming and hang around and network. So, okay, thank you.
Well, from the bottom of my heart, this panel, Dr. Ferguson, has exceeded our expectations as usual, but I think it was an incredible conversation. And I hope that we all just continue to remember it's a journey. We're not done. We're doing our best every day. And it really is fun. What Charlie didn't tell you, though, this is kind of an interesting story. When I was a nursing student at Cornell in New York City. The Tuskegee students used to come to New York City through the psychiatric nursing rotation. Then when I was in Maryland as a faculty member and department chair, the Tuskegee students would come to Baltimore also. And I couldn't figure out why. And it wasn't until I got here and I worked with Charlie in that experience that it all came together for me. And it was absolutely one of the most compelling experiences when I really put that all together. And part of being here and watching of what this community has done and what UAB has done to help pull this community together from where you started and where it started and what the image of Birmingham was is just phenomenal. But I like to tell people that the School of Nursing was part of it, and we contributed to it. And what I share with people is the architects that came in to our building to help us design the new building that we have, hopefully coming, described what they felt when they walked inside this building. And they said, Dean Harper, when you walk inside this building, it's beautiful inside, but it feels like a bunker outside. And you have to remember when this building was built. And that had never, ever occurred to me. Of course, it was also built in the Hilbert funds, and if you look at every building, they look like this. But I just think that, our goal is to open up those walls, open up those doors, open up those minds, and that's what this is all about. So thank you all very much.